artery vein, superior and inferior, four nerves are there. Okay. Next. So now this is the how the translateral. This is the lateral canal. This is the crus commune. That is the superior vestibular nerve. This is the ampullary end. This is the non-ampullary end. So now we see 1, 2, 3, 4, 5 openings into the labyrinth. So once the labyrinthectomy is done, so now we have to go into the. So you have to drill around 270 degrees to expose the labyrinthine internal artery. See, now we expose the internal artery meanders. Now we incise the sheath. You can see what is the first nerve that you see here. See this. What is this first nerve? Anyone? First nerve is superior vestibular nerve. Then inferior to that is the inferior vestibular nerve. Anterior and so that is the facial nerve. Then inside the superior you have cochlear nerve. See, you are doing dissection from posterior part, not from the what you see. The image is different, but what you see here from posterior part is different. Okay. Now you can see a small blood vessel on the facial nerve. Can you see this is the facial nerve? This is the superior vestibular nerve that I have retracted here. It is going to the ampulla of the superior subcutaneous canal. That is the superior vestibular nerve. That is the facial nerve. This is the just inferior to this is the inferior vestibular nerve. There is a very high power that I have shown for the just to make you understand. There is a fresh temporal bone where you can see the blood vessel here. Superior, inferior, facial. So orient yourself. Cochlear nerve is very thick nerve of all the nerves. Thicker nerve. Okay? So now, what is this triangle called as? Huh? Please tell the boundaries of patient. Anyone who can tell? One who can answer. Keep your mind near the answer.
Medially by vertical segment of facial nerve.
Very good.
By order and timing. Superiorly by foci.
Very good. See, it is a triangular space where some cells are there, where it is bounded medially by the vertical half of the facial nerve. Vertical half. Vertical means from here to here. Vertical half, upper half. Laterally tympanic annulus along with the cardiac like a bearing aptitude. Then superiorly by the incus buttress or foci inferior. These are foci inferior. These are incus buttress. So this group of hair cells you open into the resorting manner. So what you see once you open is the stapes, incrustopedial joint, foot plate, rounding. We extend this inferiorly to make it as a extended facial disease approach for the jugular. So now see this is the neck. You see this is the curve like this. So this is this bone we are removing to see inside. Why you do this? To remove the disease and to do cochlear implant program. So now see this. Now one question has come now. What is this triangle here and what are the boundaries? He told the answer. So please tell the boundaries of that.
Superior prefrontal sinus.
Very good.
Anterior by posterior end of posterior subcircular canal. Posterior by dura coloring sinus.
Two are wrong, one is correct. Superiorly, superior prefrontal sinus, anteriorly labyrinth, posteriorly symphytic sinus. This is a why this bone is very important here. Why should you know about this triangle? Can anyone tell? Very good. See, this is a vascular cancellous bone. You remember this. This bone is a specific. This one is a vascular bone and cancellous bone. So from here, the disease will enter into the posterior cranial fossa, cause subdural abscess first, then it causes cerebral abscess. So that is why the route to the. See now, this is the patient that we have operated long back. You see, this patient had a cerebral abscess. First we send this patient to neurosurgeon, they have done the surgery. Now you see, I am removing the granulations on the dura here. So this is route for the patient to the cerebral abscess. You see this triangle, I am removing the triangulations there. See that? This one. This is the bounded superior petrosal sinus, posteriorly by the sigmoid sinus, anteriorly by the labyrinth. Vascular cancellous bone route to cerebral abscess. So now, next, see what is this arrow point? This is a facial nerve. See now the entire facial nerve is resected here. What is this? The facial nerve pointing. What is it called as? Huh? 2 times very famous. Not once. Can anyone tell? This is the first genome, madam. This is the meatal portion. There is a labyrinthine portion. It is taking a turn at the cochlear comb process. It is taking a turn there, where it gives branch in the greater petrosal nerve, come horizontally. This is the second genome. Takes a turn, becomes mastoid portion. Now is it clear? This is the internal meatus, meatal portion, labyrinthine portion, first genome. Madam, MPC, you are not sorry. Because you are there, we should not talk about it. Geniculate ganglia, okay? So what are the structures that we are seeing now? These two. Can anyone answer? What are these two structures?
What is the joint?
This is called as double buttock sign, we call it as. This one. So anyway, sir, see this is a transfraction anticotum is done here. You see this is a fossa inclus, body of the inclus, head of the malleus, inclusomanular joint, anterior space. So this is a transmastoid anticotomy where we are seeing the. So now morning we have told you what is this structure? The sigmoid sinus. What is this? Morning I told you in the first this one. Tubular bulb. Okay. So this is the tubular bulb. When this is dehiscent here, what happened in the morning I showed you when you give incision. When you are elevating the temporomandibular flap, please be careful not to